Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Welcome everybody, welcome to episode 84 of the Hair Loss Show. I'm Dr. Russell Knudsen.
I'm Dr. Vikram Jayaprakash. Welcome.
So today we're going to talk to you briefly about beard transplantation, which is an increasingly important part in the field of hair transplantation because we get many patients asking for advice about it. And so, largely speaking, the category of patients that talk to us about beard transplants are those who are looking for spot fixes.
Yes.
Which could be because the hair was never there in the first place in the beard. It was a patchy, uneven sort of distribution or a few gaps here and there. Or maybe scarring on the face, where they want to cover the scarring up.
So I think it's really important to diagnose what the underlying cause is first, isn't it?
So that's the first one, which I'm going to get Dr. Vikram to talk about, and then I'm going to talk about the patient who never had much beard in the first place, but wants a significant augmentation of facial hair.
So yeah, there are a lot of different reasons why someone can have a patchy beard, and we're not going to go through all the possible diagnoses that could occur, but suffice to say that it's important to make sure that you get assessed properly and get a proper diagnosis. And for a large number of people, it's just because it's a congenital issue. They just don't have a lot of body hair, and so therefore the beard may be a bit patchy or hasn't grown in areas that they'd like it to. And certainly nowadays, finding fashions have changed, and big thick beards are sort of the vogue, and so people want to have more facial hair. And so for that reason, what we can do, very similar to a hair transplant, is move hair around from one part of the face to another. And so, for example, you may move a few grafts from underneath the chin and transplant those into other parts of the face. The skin is the same. It takes hair follicles just like anywhere else that we do a hair transplant on the scalp, and therefore it's using your own tissue. The hair grows, and you can sort of make an area appear more dense using your own tissue and hairs from your own beard. The cycle of the hair is the same, and so it just grows as per normal.
So ideally, if they've got enough hair elsewhere in the beard,
yes,
then they can take it from a less visible area like under the chin,
yes,
and transplant it onto the face.
Yes.
This is the ideal patient because they get beard hair growing in the beard area.
Correct.
What happens if they're thinnish, but it's still patchy, and all they want is a bit of an augmentation, but they're kind of thinnish everywhere else on the beard?
Well, then you're going to have to use hair from somewhere else.
Which would be
scalp.
Right.
So, we're going to have to look at other donor areas, and so you can take hairs from the scalp and transplant them into the beard. You want to go through that?
And it works very, very well.
Yes.
So even in our patients that have patchy hair loss, sometimes we would augment with scalp hair if we don't feel that we can take enough beard hair to get the result. But certainly I've had young men come to me and ask me if they could have a much thicker beard, and they really don't have very much beard hair at all. And that requires thousands of hairs, which they can't donate from their beard. So then we're forced to go to the scalp. Now, the caveat that I would put on this is that I'm only very comfortable about using large numbers of scalp hairs for beard augmentation if I'm convinced the patient is going to need them for their scalp later in life. Right? So I really don't want to find myself in a position of having done massive beard transplantation in a patient that was showing signs of significant thinning, which left them short of scalp hairs later in life. So I would talk very carefully to them about it. But I see no contraindication in principle to doing hair transplantation with scalp hair. It works extremely well. Obviously, you've got to be very careful with the direction of the hairs.
Correct, yes. The exit angle as well.
That's right, it's very acute. The hair cycle is different with scalp hair and beard hair. It grows at different rates, for example. But these problems are easy enough to get around. And sometimes, it's the hairs are a bit finer than the beard hairs. So again, it's useful where you take the hairs from to try and find the slightly coarser scalp hairs, again in the non-balding area back in here and the central occiput, for example, But realistically, we've done this a number of times. The patients have been very, very gratified with the results. So again, it is a good potential therapy for patients in that situation.
Absolutely. But also the other thing of interest to talk, and we got sort of getting into a little bit into the minutiae here, but hair comes out of the scalp. If we're using scalp hair, for example, hair comes out of the scalp 1 at a time, 2 at a time, three times, sometimes 4 at a time. You wouldn't use your 3 and 4 hair follicular units.
In a beard, that would look clumpy.
Correct, yes. So it's about choosing the right grafts as well.
Well, or cutting them down, right?
Yes.
So if you ended up, let's just say you did a strip instead of FUE. With FUE, you can select, right? With FUE, you can select the hairs you want anyway. In strip, you're getting everything. So if you've got 4 hair grafts that you can cut down into 2 hair grafts, or 3 hair grafts you can cut down into 2 and 1, as long as it's done accurately, both those grafts are very nice to be implanted into the beard area. So it doesn't matter which technique the harvest is, it just has to be prepared slightly, but the goal is to only use 1 or 2 hairs at a time in the beard.
To give it that natural look and make sure the design is done properly. So we spend a lot of time when we're doing beard hair transplants, really making sure that we've got the design of the beard
and to not make it too clinical, right? Yes. The idea is not to have sharp lines of delineation between the beard area and the non-beard area, because that draws the line to it. So it's about blending it in and keeping it nice and soft at the edges.
Good. That's great. I think that covers beard transplant. Thanks very much for watching, and we hope to see you again on the next episode.
Keep subscribing, guys. We're very gratified by your response.
Yes, absolutely. Thanks very much.
Cheers.